Thank you all, and I'm really grateful for being here, and I'd like to thank Terry Allen from our Cuyahoga County Board of Health for inviting me here to this forum to talk to you folks. I'm going to talk to you from a little bit of a different angle, and it may seem a little redundant, but very relevant, because part of the work that we're doing in Northeast Ohio is really working on influencing policymakers to look at their work through a social determinant of health lens. Now, that's not an easy thing to do, particularly when we're talking about policymakers. So part of what we are challenged with is conveyance. How do we convey the message? How do we frame the message? So I want to share with you today a little bit about how we in Cuyahoga County are working and how we are actually conveying the message to our local officials. We've all been a part of a national organization known as Place Matters. Place Matters is a national initiative of the Joint Center for Economic and Political Studies Health Policy Institute. Place Matters was designed to improve the health of communities by addressing social conditions through policy and or systems change. And I'll talk a little bit about the systems change component in a moment. The Cuyahoga County Place Matters team engages policymakers and community members to use an overarching health and equity lens for the development of policies that create the conditions for optimal health. This is an example of the members of our team that come from various sectors, various organizations. And what we try to do is, one, improve social determinant of health knowledge. We actually are very deliberate about creating cross-sectoral collaborations. We want to make sure that public policy is something that we focus on because we believe that's a critical component. And we also want to impact the social change ethos. This is an example of the diversity that we have on our Cuyahoga County Place Matters team. Local public health departments, land use planners, academic institutions, developers, community residents, city and county government. So it's a wide partnership. What's interesting about Northeast Ohio, though, is that we can sometimes mistake activity for success. We have quite a bit of health initiatives that are going on throughout the county. But one of the things that we want to try to do as a Place Matters team is really begin to penetrate those initiatives to infuse the equity lens into that, focus them on disparities. And oftentimes, we have to convey things in a way that's very simplistic. It's okay to be complex with groups like this, but when you're talking to an elected official, and I know the conversation came up earlier, you really have to dumb things down to make it clear and to make it plain and to make it digestible. One of the initiatives that we did, I was actually the project manager of, was our city's comprehensive plan, Connecting Cleveland 2020. And one of the principles of that plan was creating a city that's a model for healthy living. And that was great because we looked at things like community partnerships to provide opportunities for recreation, et cetera, sort of your typical things. But fast forwarding a few years after that plan was adopted in 2007, the mayor initiated what we call the Healthy Cleveland Initiative. The reason why it kind of turned on our light bulbs from the Place Matters perspective is that he used the term, he wants to create a culture and lifestyle of health. And this is a copy of the newspaper article where he made that statement. Now, that's a tall order. And it's a great vision to have, but we were wondering, like, wow, does he know what he just said? And it excited us. So that was a trigger for us to say, okay, this is a touch point. This is an opportunity to really engage. So one of the things that we did working with the Place Matters team was really start to frame out, how do you have this conversation? What does systems change look like? And this model became a very valuable tool. And forgive me for my presentation being model rich, but it's a really good way to convey information. One of the things that we talked about was the fact that if you're going to change a system, you have to do it at all levels of the hierarchy. Number one, you have to change values. You have to change policies, meaning influence legal and regulatory requirements, and we as a planning department, because we actually have the ability to influence development policy, we kind of fit into that space. Changing organizational practices, cross-sector collaborations, community engagement, expand access, and all of these things have to be in play. So the other thing that we did is we began to just raise the basic question: what is it that makes us healthy? Is it exercise? Is it access to care? Is it food? Is it medicine? These were all the typical things that most of the elected officials could connect to. But what we did, we posed a question to them to assume that it's all about personal responsibility. So we were inspired through our Cuyahoga County Board of Health Department through a gentleman by the name of Dr. Anthony Iton. How many of you are familiar with Dr. Iton? Brilliant mind. And he gave us a sort of framework that we in Cuyahoga County refer to almost as the Bible because it was important to us because we saw ourselves in it. And it was very opportunistic in conveying the message to the people who we are trying to influence. And one of the things that the model begins to look at is really looking at risk behaviors and their connection to disease, injury, and mortality. But taking it a step further, going upstream to look at what we call neighborhood conditions, institutional power, discriminatory beliefs, and structural factors like race, class, and gender. So as a planning professional, I saw myself fitting into that neighborhood conditions piece. We are actually responsible for creating conditions for people to have optimal health. And for me, it made me feel very responsible. So it sort of changed the mindset of our commission. It changed the mindset of many of our elected officials. We started to understand better disparities that existed between communities and understood that these factors upstream have really created the disparities downstream. So this was a revelation for us. We also started to articulate to our elected officials the basic fundamental terminology of what it means when we talk about health. Now, you all know this, but when you're talking to an elected official or you're talking to a board of commission, we want to make sure that they understand fundamentally what is it that we're talking about when we talk about population health, and why is the city planner talking to me about it? So we wanted to be in a position where we can show them the broadness of what it meant when we talked about public health and human impact. Looking at the social determinants of health, these fundamental definitions were very important in articulating that. And from a planning perspective, when you look at some of the economic and social conditions that exist in our communities, and it's prevalent in many communities throughout the country, things like poor ventilation, mold, rodents, we have those conditions in our communities. We have one of the largest abandoned property problems in the country, in the city of Cleveland, and we're dealing very effectively with that. But these are all issues that we face. Crowding, hunger, dangerous streets. You talk about transportation. We have many transportation hazards throughout our city. Worsening traffic conditions, poor quality food, no places to play, declining and moderate wage jobs, and economic diversity dwindling, limited access to jobs, healthcare, and friends and families. So when you look at this from a land use perspective, we look at sort of the lack of housing, the lack of quality education, lack of food access, lack of healthcare access, lack of recreation. These are all things that can be managed. And when you have these high demands on people and they have a low locus of control, it equals chronic stress, which we know when we talk about health is the underlying culprit to many health conditions. So how do we begin to mitigate that? And I'm not going to go through this with you because you medical types probably know this already. But one of the things that we try to bring into the fold is this dialogue around health equity, which is really important to understand. And health equity is a fair opportunity to attain full health potential. And no one should be at a disadvantage from achieving this potential if it can be avoided. This diagram really paints a very clear picture of the health, of what it means to have a healthy community versus a non-healthy community. And as you can see with the dwindling tree on the right, that the fruits of that tree are things like violence, smoking, substance abuse, HIV/AIDS, etc. But at the root are things like adverse living conditions, segregation, poverty, things we don't typically associate with those outcomes. This was new to many of our elected officials. And we also understood and conveyed that the choices we make are shaped by the choices that we have. Many people are inundated with poor food choices in our communities. Therefore, they make the wrong choice about what they eat. Another sort of aspect that we started to use to sort of convey this message was really to look at it from a geographic spatial sense. And these maps, these are from the 2000 census. And the legend basically shows where red equals white, blue equals black, green is Asian, orange is Hispanic. Now these cities that you're about to see are on different levels of the economic spectrum, but they have one very similar thing in common, and I'll let the maps show you. Atlanta, Boston, Buffalo, Charlotte, Cincinnati, Columbus, Washington, D.C., Detroit, Cleveland. So it doesn't matter where in the nation you are, that commonality of segregation is very evident from a place-based standpoint. And utilizing geographic information systems, GIS, in Cuyahoga County, we were able to identify one of the largest disparities in life expectancy that was found nationwide, which was a 24-year life expectancy difference between the community of Huff and Lyndhurst. That was very significant. That touch point really triggered and launched a dialogue that really ignited multiple sectors in Northeast Ohio. And I don't have time to go into everything that we are doing, but there's quite a bit that I hope to share with you in the discussion period. But I think that conveyance of the message, framing the conversation, is probably one of the most critical things that we can do, particularly if we're coming at this from outside of the medical sector. Thank you.
Our next speaker is Rochelle Davis, who's the CEO of the Healthy Schools campaign, who's active around the country, and I think she'll tell us about contributions of schools.